morning. I am Professor Salvatore Novo from Italy. I am a full professor of cardiovascular disease in Palermo and past president of the Italian Society of Cardiology and the Italian Foundation on Heart and Circulation. For me, it's the second time that I participate in this very important Congress on hypertension and cardiometabolic syndrome. This the kind of pathology is very important for the cardiovascular risk of patients and for the development of cardiovascular risk in the future. And surely this Congress is of high scientific levels and the participation is increasing from year to year. So I believe that it is a good event because most people from different countries of Europe, but also of the world, from the Middle East, from China, Japan, etc., participate, and this is a good occasion to have a change of opinion and to grow out the culture in cardiovascular disease.
Hello, I am Professor Haller from Germany. I'm here at the meeting on pre-hypertension, and we provided evidence on the importance of the early changes of the microcirculation in patients with hypertension and metabolic syndrome. We believe that these early changes are important and that especially the microvasculature is responsible for later cardiovascular morbidity and mortality. The meeting is excellent. There was a lot of discussion, and it is very nice to meet all the colleagues and to have an integrated view on these novel aspects of cardiovascular disease.
I am Enrico Agabiti Rosei. I'm professor of internal medicine at the University of Brescia, and I am the current president of the European Society of Hypertension. I have participated in this international conference dedicated to pre-hypertension, hypertension and cardiometabolic syndrome. Indeed, the issue of the pre-hypertension is a very important one because subjects with systolic blood pressure between 130 and 140 and diastolic between 85 to 90 millimeters of mercury are at high risk of becoming established hypertensives. That is with blood pressure stable above 140 overnight. And they are at increased risk of developing organ damage, initially asymptomatic organ damage, and then progressing to more severe diseases. So the issue is when to start treatment in these patients, that because at present time we don't have randomized clinical trials indicating that reducing high normal blood pressure using pharmacological antihypertensive drugs is of any benefit in preventing cardiovascular events. This has been discussed in this conference, and the conclusion was that these patients should be followed with frequent blood pressure assessment and evaluation of organ damage, and then starting treatment as soon as the global cardiovascular risk is increased.